Now, from Eyewitness News, this is a Rhode Island COVID-19 Congressional Town Hall.
Welcome to this WPRI 12 special presentation, a Rhode Island Congressional Town Hall on COVID-19. Tonight, we will go in depth on a range of critical topics and ask some of your questions sent into 12 Responds. Good evening. I'm Target 12 investigator Tim White.
And I'm WPRI 12 politics editor Ted Nesi. As you can see, we are joined by all four members of Rhode Island's congressional delegation streaming into our studio via Zoom. And you see Congressman Jim Langevin, Senator Jack Reed, Congressman David Cicilline, and Senator Sheldon Whitehouse. They're joining us tonight as lawmakers on Capitol Hill continue to discuss whether to pass a fifth emergency spending bill.
And a Target 12 analysis shows Rhode Island has been awarded nearly $2 billion in federal coronavirus funding so far as the entire region and country grapple with the impacts of COVID-19. The lost spring is quickly becoming the lost summer, and health officials warn restrictions will likely stretch on for the foreseeable future.
The ripple effects have been devastating to life as we knew it. Unemployment claims in Rhode Island are approaching 250,000 as thousands of businesses have been forced to close their doors.
What has defined summer in Rhode Island, from festivals in Newport to parades in tourism, canceled, and parents and caretakers have become teacher assistants as living rooms have turned into classrooms.
The question is, when will life begin to feel normal again, and what will it take to get there?
Now, I want to point out that Ted and I are practicing social distancing. We are more than 6 feet apart here in the studio. And of course, each member of the delegation is joining us remotely from separate locations. And for those of you at home, you can follow along on social media using the hashtag 12townhall. Okay, gentlemen, I want to go around the Zoom briefly, if we could, to get the conversation kick-started. I'm looking for a short answer from each of you on this topic. Now, the House last week passed another stimulus package. It is now being considered by the Senate, where it has gotten a very cold reception by Senate Republicans. I'm sure there are a whole host of elements in the bill you think are essential, but choose the single most important aspect of the legislation that is non-negotiable to you. In other words, what has to be in the final product? Senator Reed, we'll start with you.
Well, first, let me thank the people of Rhode Island for incredible service and sacrifice on behalf of their fellow Rhode Islanders. And to respond to your question, I think the critical element would be additional support in terms of grants for the state. We put in the first go-around, or one of the first go-arounds, the COVID relief fund. I think we have to put more money for the states, and we have to give them more flexibility. If we do that, we'll be better prepared not only to cope with the crisis, but better prepared to recover our economy quicker and move forward more dramatically when the COVID virus is defeated.
And Ted and I want to talk a little bit more about the grants to the states later on in the program. But Senator Whitehouse, now to you, what's number one on your list?
I think the same. State and local funding. We can't get into a situation in which we're having to lay off police departments, first responders, the people who are in hospitals around the country that are run by counties and by cities. That, to me, is pretty critical.
Congressman Cicilline, the House passed this legislation. As I said, it's now in the Senate. When you were voting on this, when you were working on this as part of House leadership, what was non-negotiable to you? What had to be in there?
Yeah, I think for our whole caucus, the number one priority was state and local aid, making certain that those on the front lines of this pandemic that are risking their lives to keep us safe, our firefighters, police officers, healthcare workers, grocery clerks, that state and local aid so that communities would endure, be able to really get through a tremendous decline in revenue. This is really important. In the middle of a pandemic, you can't have layoffs in police and fire departments and first responders. And the second piece was non-negotiable is testing and tracing, $75 billion so we can really have broad-based testing all across the country, contact tracing, isolation when necessary, so we can defeat the virus. Those are really the two priorities for me.
And Congressman Cicilline broke the number one rule on his answer. Congressman Langevin, what was first on your list in the bill?
I completely agree with my colleagues that we recognize that Rhode Island is potentially facing an $800 million deficit, and that would put tremendous pressure to lay people off. We can't have that right now. Again, these frontline workers are so critically important to our state always, but especially right now. So making sure that aid for states and municipalities when there has to be a priority, number one. And then in addition to that, I couldn't agree more about the testing, but also hazard pay for frontline workers was something else that is critically important. Whether it's the people in our hospitals, our healthcare professionals, people at our grocery stores that are keeping our grocery stores open so that people can feed their families. They're on the front lines, putting their own health at risk. And hazard pay is something that had to be in this package, and I'm glad to see there was, allowing them to earn up to another $13 an hour on top of their regular wages. So all of these things are important, but those are among the top priorities.
Well, and of course, this still has to get through the Senate. And Congressman Cicilline, I want to ask you, stay on this topic, ask you a question as a member of House leadership. There's a whole bunch of other things stuffed into this bill that seemingly have nothing to do with the pandemic, like allowing marijuana businesses to access banking. You knew you had to get a Republican Senate and a Republican White House to pass this. Didn't House Democrats make it harder by putting all this extra stuff in there?
Well, first of all, most of the bill are provisions that the Republicans in the Senate have already supported. That is state and local aid, testing, additional support for healthcare providers, our hospitals and community health centers. So 80 or 85% of the bill, the Republicans in the Senate have already voted for. And so this is a bold package that responds to the gravity of the moment. It's $3 trillion. It's direct cash payments for families up to $6,000 a household, testing, hazard pay, almost $1 trillion in state and local aid, and a number of other things to support healthcare, COBRA support, additional enrollment periods, additional increases in SNAP. So it's a very robust package that we believe responds to the.
Well, what about that? What about that 15 to 20% here? You know, Majority Leader Mitch McConnell, he said this is a list of long-standing wish list of items that are completely unrelated to the crisis itself. Do you feel like jeopardize the bill?
It's just not true. This is a bill which reflects the priorities of the American people. That is making sure that we have that people have money in their pockets, that get access to testing, that we're supporting our frontline workers, the heroes fighting this pandemic, that we're supporting state and local governments so we can protect people from tax increases, that we're supporting access to health care. And the reality is that's the bulk of this bill. If there are provisions in it that Mitch McConnell doesn't like, he can do a couple of things. He can pass his own bill, send it to conference, and we can negotiate a compromise. He can amend the HEROES Act and in ways that he thinks is appropriate, send it back to the House. And that's the legislative process. But we're very proud of the bill we put together that responds to the gravity of the moment that we're in. People are hurting out there. Small businesses are suffering. Families are being crushed economically. They're worried about their health care. This bill responds to that in a bold, strong, powerful way, in a way that I think reflects the gravity of the moment and the urgency of the work that needs to be done.
Senator Whitehouse, I want to wrap up this topic with you. You know, you've talked about it and you've prided yourself in finding ways to get bills passed with your Republican colleagues. What do you think? Could the House have carved out legislation that would have been a little bit more palatable to the Senate?
I don't think that would make a difference. I think the problem is more complicated than that on the Senate side. You're looking at Mitch McConnell as somebody who is dealing in good faith and might look at one portion of the bill and say, well, I don't really like that, and then be so upset about it that he stops the whole bill with local and state aid, with hazard pay for people who are out there working hard for us, with testing, the key thing to reopening the economy, with hospital support for struggling hospitals. It just doesn't make sense. I mean, I think this is a bit of a spin tactic by McConnell and the Republicans, and they have absolutely no credibility on this subject because they're the ones who in the very first bill stuffed in $100 billion for people who make more than $1 million a year, not to their businesses, to their personal tax returns. And they snuck that in, and if there's anybody in the world who has no credibility about slipping things into bills, it's Mitch McConnell. He's an Olympian after that stunt.
All right, we want to turn to unemployment benefits. This has been a big topic and something all of you have worked on. And Congressman Langevin, we'll start with you.
on this topic. The HEROES Act, the House bill we've been talking about, would continue paying people on unemployment that extra $600 a week through the end of the year that's currently in place. I want to ask you a question we received from a viewer named Dottie. She says, quote, many employers are saying they will go out of business for lack of employees willing to work due to the extra $600 unemployment pay. Aren't you causing the very thing you purport to prevent, high unemployment? What's your answer to Dottie, Congressman Langevin?
The answer is that we needed to get money into people's hands as quickly as possible so that they could put a roof over their heads and put food on the table. When we can bring our employees back, they can no longer receive unemployment compensation. That's why the PPP program was so important, so that employees could retain their employees on the payroll. That PPP program loan turns into a grant as long as the employer brings it back 100% of their workforce and has them off unemployment or not go on unemployment in the first place. But the extra was there. If someone is getting unemployment, they're only getting about $300 a week or so. And we needed to put additional funds in there to, as much as possible, make them whole. I've heard the argument. I know that there are some people perhaps that might take advantage of the situation. But I think the vast majority of people want to go back to work. They want to be able to provide for themselves and their families. And the sooner they can get back to work, I know that everyone's going to be a lot happier, most especially the workforce.
Senator Reid, you've been very active on unemployment insurance policy for years, and you have your own bill you've recently put forward that would also extend the $600 unemployment boost to the end of the year. We certainly have heard from many viewers for whom this was a help, but we have also heard this concern from business owners. How do you balance that going forward?
Well, I think it's necessary to get this money into the hands of working families. And for many families, this is basically just paying the rent or the mortgage and the other essentials. Without it, they would be in a desperate situation. That's one aspect, helping families. The second is it helps the economy. This money is not being hoarded. It's being spent. It's being spent for groceries. It's being spent for lots of activities. So it's helping us, the state at least, maintain some economic activity. So I think in both those cases, this adds to not just individual families, but to the overall state economy. I think the other factor here too is people understand that first, if they're offered their job back again and they say no, then they're no longer under the law entitled to unemployment benefits because they have to be able and willing to work. That's something that's very clear and something that can be enforced.
So that is the law, Senator Reid, under this, that you cannot refuse to go back if your employer is able to give you your job back?
That the law is that, as I understand it, and indeed as we've codified it in the legislation I proposed, is that if you are offered your job and you turn it down, then you are no longer entitled to these benefits. These benefits are designed for people who don't want to work and can't work. That's the essence of the unemployment insurance fund. I think the other thing too that's critical to understand in terms of this unemployment situation is not only do we have to have these resources, but these resources can't be terminated at a fixed date because the unemployment crisis will not terminate at a fixed date. We saw this experience in 2008, in 2009, and 2010, where I was fighting along with others, Senator Whitehouse, my colleagues in the House, because Rhode Island was in very bad shape, but other parts of the country were doing okay. So extended benefits were lost. We were able to get them established, but we need also, in addition to the resources, the payments, we also need to extend this until particular states are out of the woods. So establish a level of unemployment or several levels where benefits can be reduced based on the employment of that state. That's another aspect of this that's very important.
All right, I want to get to another viewer question. And we've received more than 13,000 emails from people seeking help into 12 Response since we launched it more than 2 months ago. And I want to get to this one early in our town hall because we get this one a lot. Carolyn writes in, I did not receive my stimulus check. What do I do? Congressman Cicilline, you know, I appreciate everybody's circumstances are very different, but you have told me that this is probably one of the highest volume calls that you get into your office. What do you say to people who are in Carolyn's position?
So the first thing we do is we encourage people to go first to irs.gov. There's a lot of good information on the IRS website. If they have not received their check or direct deposit in their account, they should reach out to one of our offices and we can help find out what happened. For a number of folks who have not filed tax returns, it may be that they have to provide the IRS either with account information or a mailing address because they don't know where to send the check if they haven't filed a recent return. So there, we press the administration hard to move quickly to do these deposits automatically. They originally were resistant to that, but they ultimately agreed, although the president insists on some of the checks awaiting a letter with his signature. But there are some folks who still haven't received their checks because of lack of information from the IRS. So if people are not comfortable going onto the website and providing that information, they should reach out to one of our offices and we can help them navigate that.
And a quick follow-up, in a worst-case scenario, Congressman, could it be that some people just have to wait until January until they file their taxes again? Is that possible?
Well, it should not be the case. I mean, that defeats the entire purpose. People need this money now, and so we'll do everything we can to make sure they get this money as quickly as possible. We've pressed the administration hard to accelerate this process and have had some success, but if there are folks who still have not received their check or their direct deposit, they should be in touch with us and one of our offices, and we'll help them navigate that and find out why.
I want to turn to a question for all four of you on touch on the Paycheck Protection Program. This, of course, is the loan program for small businesses that was created in the CARES Act, and more funding has been added to it. Under current law, the small businesses must spend the money on payroll over 8 weeks in order to have the loan forgiven. There's now talk in Congress about extending that past 8 weeks. So I want to ask all of you, do you support extending that PPP period more than 8 weeks? And if so, how long should it be? And I'll start with you, Senator Reed.
I absolutely do support it. What we found out is despite the best efforts of many businessmen and businesswomen, they can't reassemble their entire workforce in that shorter period of time. They need more time. They should be given more time. I think reasonably it should be extended, not from its terminating the end of July. It should go late into the fall and allow people the opportunity to reestablish their workforce as their establishments are reopened for business. And at the end of that period of time, much longer than the period at the moment, that's a fairer way to reevaluate and to determine the forgiveness on the loan.
Senator Whitehouse, same question. Extend the PPP loan, and if so, how long?
Yes, absolutely. And for as long as local economic conditions based on the coronavirus require. And we should also, by the way, free up a little bit of the funding available for rent. There are a lot of small businesses for whom rent is a very big idea, big expense, and 25% for those people is too little. So we want more flexibility on rent, longer time period on the payroll.
Right, because right now it's largely around payroll. Congressman Langevin, to you, same question. Extend the PPP duration, and how long do you think if so?
That's right. I absolutely think it has to be extended, and that's what we've done with the in the HEROES Act. We wanted to make sure that there's an extension there, because for some people, many businesses, the 8 weeks is just too short. And we've had many businesses say that we may not be able to bring our employees back on right away, especially in the restaurant industry, hospitality that's been particularly hard hit. It's been devastating for many restaurants in Rhode Island, some of whom are afraid they won't be able to open their doors again. So we need to have maximum flexibility in being able to take advantage of the best aspects of the PPP program, which were allowing businesses to bring out their employees back onto the payroll, basically keep the family together, if you will, so they keep their team in place, so that when the governor in the various states gives the okay under the guidance of public health officials, that you've got your workforce intact and you're going to be able to get your operation back up and running. So you would be able to, that loan would become a grant. You have to use at least 75% of the loan for payroll, but then the other remaining 25% can be used to cover your rent or your utilities, to help you ride through this this shutdown right now through no fault of their own, that they had to close down the business. And we want to make sure that as soon as very possible, we can get things up and running, and we've helped businesses ride through this terrible coronavirus crisis that we're confronting.
And Congressman Cicilline, you voted, of course, for the HEROES Act as well, which had an extension in it. So I presume you're also on board?
Yeah, absolutely. And in fact, we've all met with small businesses here in Rhode Island, and one of the biggest concerns that folks had was that 8-week period was just not realistic for most businesses. I think when PPP was designed, that might have been an overly optimistic period of time. So we extended to the end of the year, to December 31st, the period of time in which you have to bring employees back. I think that's a lot more realistic. But as Sheldon mentioned, we ought to be prepared to extend it further if the conditions on the ground don't allow businesses to safely bring back all their employees even by that point.
And just one follow-up to Senator Whitehouse. You mentioned potential changes, including adding it to rent. Do you have any sense of how high this is on the, you're in the minority granted, but on the Senate majority's radar? So small businesses watching tonight might wonder, well, when will they get to do a bill to potentially extend this, et cetera?
Well, Leader McConnell said that he doesn't feel any sense of urgency. And I think that kind of blew up in his face. I think he's got maybe a couple of weeks that he's going to stall, but pressure is going to continue to build from within the Republican caucus to get this done as well. They're hearing just the same things from their business communities that we're hearing from our small business community. So I think it's pretty inevitable that the PPP program is going to be recharged. And when it is, we're going to fight very hard to make sure that it's both recharged and extended, and there's more flexibility about rent. So I think that I'm optimistic, I suppose, about this, but I think in a couple of weeks, there'll be something going on in the Senate. He can't stall this forever. He can't pretend there's no urgency for long.
I want to take a pause. Go ahead, Congressman.
Yeah.
Go ahead. Yep.
I think it's a really important point. I spoke to the speaker today about this very issue, and the reality is there's tremendous support for what is contained in the HEROES Act. Republican governors, Republican mayors, U.S. Conference of Mayors, the National Governors Association, business groups are all speaking out about the importance of moving forward with this fifth relief package. And the majority leader in the Senate originally said, states should just go bankrupt, or we should just wait and see kind of how things turn out. We can't wait and see. We see every single day the consequences of this pandemic on the economy of our state, on the healthcare system in our state. We cannot wait. We know we need action today. And I think the pressure is going to continue to mount, and Mitch McConnell is going to be forced to take legislation to respond to the urgent challenges facing our country.
Well, let me ask then Senator Reid as well. I mean, Senator Reid, you were one of the negotiators on the CARES Act. That came together quite quickly. I remember talking to you the next day, and you said you'd been working on it all through the evening the night before. I mean, do you get a sense, do you share Senator Whitehouse's view on how soon the Republican majority might move on something?
I think Sheldon's accurate. The pressure is building up on Senator McConnell. I mean, he first started off, as David indicated, by saying, let the states go bankrupt, let's wait and see. What's going to happen, though, and what is happening, is that when our colleagues go back home, they're getting the same kind of comments we are. State government is really in disarray. We have to lay off highway patrolmen and sheriffs. We don't want to do that. We need help immediately. That is going to build up. I think the other factor, too, and this prompts the White House, I think, more than McConnell, is the market. If the stock market starts sliding, and it's been up and it's down, but if it starts sliding, that'll be a real incentive, I think, for President Trump, because he pays attention to those issues. And again, when we were doing the negotiations on the legislation, the CARES Act, that was at a time where we were in something of a free fall. The markets were falling. There was a sense of real desperation. I hope we don't have to go that far back to get the bill moving, but I think what you're going to see is gradual pressure building up, both from the financial markets and from individual senators right now. Take the issue of state aid. McConnell said, let them go bankrupt. That's not the case. Senator Round, the Republican former governor of South Dakota, is someone who supported this aid package, or some aid package. Senator Cassidy of Louisiana, Senator Portman of Ohio. So you're beginning to see individual Republicans publicly saying we've got to do something. That'll be it. Actually, I think we should be doing it right away. The faster we get these resources into the economy, the more likely we are to have a rapid recovery. The longer we delay, the longer we're attempting a situation where the recovery is rather slow. It's not a V recovery, it's an L recovery. So just from the self-interest of getting the economy moving again, the faster we get these resources into the system, the better off we'll be.
I want to pause on the policy discussion just for a moment, but it's Ted and I, so we'll definitely get back to that, and hit up each of you on some recent headlines that a lot of our viewers have probably seen from the week. And Senator Reid, we'll stick with you on this question. What was your reaction, I'm wondering, when you heard that President Trump was taking hydroxychloroquine?
Well, the same reaction I had when he suggested people drink Clorox. It's something that medical doctors do not encourage. In fact, the research that we've seen has suggested.
Now, we should say that the president didn't say to drink Clorox. I think you're probably expanding a little bit on what he said.
He just suggested studying or something along those lines.
Well, he gave a very strong suggestion that Clorox should use as some type of antidote to this disease in a cryptic way. But I think for a lot of people, the sense was that might work. In fact, I think they were deluged with calls from people saying, how do I do it? How do I, et cetera. The other factor, too, is that as soon as the president announced that he's taking this medicine, his press secretary had to go out and caution people to go see a doctor. So again, I just don't think that the president should be advocating treatments, medical treatments, that have not been vouched for and supported strongly by the medical community. Here's a case where this particular medicine has side effects. They're known side effects. There's been research showing that it has complicated medical conditions. It could prompt them. You can't take it if you have certain conditions, et cetera. Again, it's not the right message, I think, for the president to send. And I think it was being sent not as good advice from someone who's knowledgeable about medicine. I think what he was trying to do was just to diffuse the controversy about the scientist who was fired by BARDA, which is a research agency in HHS, because he spoke out strongly that this chloroquine, I believe is the pronunciation, is not an effective medicine. So, this is not medicinal advice. This is another sort of statement by the president to deflect attention or to reinforce his position, which is rather idiosyncratic.
Well, let me bring in Congressman Cicilline, because you are on Speaker Pelosi's leadership team, of course, and I have to ask you about her comments last night on CNN when she was asked about the president's new regimen with hydroxychloroquine. She said it was risky in part because Trump is, quote, morbidly obese. I mean, is that the kind of comment that's helpful as you try to find a bipartisan path on some big stimulus bill?
Well, look, I think it's a fact. That is the description as is contained in the president's medical report. It's true. He's also of a certain age, so he has pre-existing conditions that makes it very dangerous. But I think Senator Reid's point is the important one. This is just another example of the president of the United States not recognizing that in the midst of a global health pandemic, a health crisis that's killed more than 90,000 Americans, infected more than 1.5 million Americans, that this is not a time for the president of the United States to be saying and doing things which suggest that there's a certain medical remedy that people ought to consider. It's dangerous, it's irresponsible, and I think it's an effort of the president to distract from his own failures of leadership, to also distract attention away from the firing of his fourth inspector general, as well as the scientists that Senator Reid mentioned too. This is the response that has been chaotic, that from the president from the very beginning has tried to diminish the significance of this threat, played it down, said it was going to go away.
Congressman, I can hear our Republican viewers yelling at their television saying, it's been tough in every country. How can you put so much blame on him?
Look, the reality is Donald Trump is not responsible for the coronavirus, but he is responsible for the federal government's response to the coronavirus. It has been chaotic. He has diminished the significance of this threat. He was very late in beginning to develop a response by at least 6 weeks. And the failure to rely on science and public health officials and to try to give advice, which is dangerous, I think is just one more example of a failed leadership by this president. And what we need now, and we'll have plenty of time to do a full after action plan and review all of that. What we need right now is to make sure we expand testing, that we support our hospitals, our people on the front line, and that we get Rhode Islanders and people all across this country through this economic crisis by supporting them in the way that the HEROES Act does.
Let's get to Congressman Langevin now. And Congressman, I'm going to completely shift gears on this conversation. Major question or topic we get from parents and caregivers is about schools. And you're talking to experts as a member of Congress. From what you're reading, from what you're hearing, Congressman Langevin, how likely do you think it is that remote learning will continue this fall? What do you think?
Unclear. And again, that's going to be based on the best advice from medical professionals. It's so important that political leaders right now let medical professionals do their job, and we take them for the years of training that they put in becoming medical professionals to give us the guidance and the best information possible to make these decisions. I know Governor Raimondo has had obviously a lot riding on her shoulders right now. I think she's done a very good job under very difficult circumstances getting the state of Rhode Island through this crisis. Ultimately, we were making those recommendations, and those decisions will be made in the fall, data dependent, circumstance dependent. Obviously, we want to get our kids back to school as soon as possible. No one ever thought that they were going to be ending the school year this way. I have a niece who's graduating from high school basically next month. It's not the type of graduation that she expected that she would have, and all of her classmates and kids around the state, around the country are facing the same dilemma. And we, of course, want to get the schools open as soon as we can, and having the kids start in the fall is what we all hope for. But we really do need to let medical professionals guide us in giving us the very best information. We're going to monitor, and that's why situational awareness and testing are just so critically important as we monitor this virus and find, is there going to be an uptick as we get through the summer? Will it level off? Will it be significantly diminished? We don't know if this virus is in fact going to come back with a vengeance or not. Dr. Tony Fauci is one of the most respected epidemiologists on the face of the planet. I've known him for more than a decade. He has an impeccable reputation. And we know that, according to what he has said, that in the fall, that it is possible that this virus could come back. And in other pandemics, we've seen it come back even worse than the first outbreak. So that's why testing and remediation right now is just so critically important. And hopefully we'll have a better outcome in the fall. But we don't know that right now, and we have to be vigilant as we approach, because we go through the summer and approach the fall.
Senator Whitehouse, we heard from quite a few viewers leading up to the town hall tonight who are frustrated about reports that China misled the world about the extent of the initial coronavirus outbreak there, potentially making the pandemic worse. You've talked up on China in the past, particularly about their currency issues, I remember a number of years ago. Do you think China was duplicitous, and do you think there's any role for the United States to take action, if so?
I think China was slow to respond and slow to come clean about what was happening. They have been up to no good for some time with their intellectual property theft, their cyber theft. Nobody is more expert than Jim Langevin in understanding the cyber hazard that China has been for quite some time for all of us. They have, in fact, manipulated their currency. And I think they were very cautious once this began to emerge in Wuhan province to try to keep a lid on it. On the other hand, they did respond very robustly. They did knock their numbers down. And whatever happened in China, to David's point, it does not justify the sloppy and chaotic way in which this administration has tried to deny its way through the problem. And thank goodness for people like Tony Fauci and Ambassador Birx and people who are true professionals, that they're fighting uphill against the tide of the tone of this presidency. So yeah, there's blame on China, but you can't throw the whole situation into China's lap and say, we did fine, we don't have anything to worry about, this is all China.
Well, let's move from China back to Providence and the state budget, and we've already alluded to the challenge there. just today, Rhode Island State Budget Office released a report saying the state is facing a $235 million budget deficit for the current fiscal year. And just to make that clear to our viewers, that's a $235 million deficit shortfall in the budget year that's almost over, that ends next month. So, Senator Reed, I want to start with you on this one. Governor Raimondo has said she wants to wait and see what happens with federal assistance before they start to really work on the budget, because it's such a large hole, and she's hoping that more money will be delivered. But is it time for state leaders in Rhode Island to start making contingency plans if Mitch McConnell and the Senate Republicans have not decided to put more state aid forward by the time the fiscal year is over?
Well, I think first, the federal Treasury Department has to be more flexible with the $1.25 billion that has already been delivered to Rhode Island. And I once again delivered that message today to Secretary Mnuchin at the Senate banking hearing.
But it doesn't sound like he's coming around to your point of view.
I hope he comes around to my point of view, because it's a point of view that is shared by Republican and Democratic governors, by people throughout the country. And I think, frankly, I think Chairman Powell of the Federal Reserve was also sympathetic, although he didn't choose to comment. But that's a critical aspect. If that could be clarified within weeks, that would give the state much more clarity in terms of their own budget. I think also, too, is that with the pending legislation, which the House passed, and Jim and David did a remarkable job getting it through with their colleagues, if we could accelerate that and get that done in a reasonable period of time, then before the June 30th fiscal year deadline in Rhode Island, they would have more clarity, more ability to program funds. It very well might be, and again, this is a function of the delay that's being imposed by McConnell and others simply because they don't want to deal with it. That delay is complicating the situation in Rhode Island tremendously because they're wondering if they'll have additional resources. They might have to go ahead and put together some type of contingent budget for the following year with opportunities or mechanisms which to incorporate federal funding that becomes available. But time is of the essence, and Rhode Island's not alone. There are states all across this country who are facing the same dilemmas that Rhode Island has, and I hope, as I've said before, that will encourage their senator to stand up and say, we've got to do something, and we've got to do it quickly. And I hope that's the case.
Senator Whitehouse, you've been in the Senate now, 14 years. You know the pace of things up there, and you talk to your Republican colleagues. How likely do you think it is that significant budget assistance is approved in the Senate for Rhode Island beyond what's already there by the end of the fiscal year, June 30th?
I couldn't guess. As I said earlier, I'm optimistic. I think Mitch McConnell's runway is going to run out in a couple of weeks. The tolerance of his caucus for his statement that there's no urgency here is going to fade. And I think you'll see county governments and city governments and state governments all around the country beginning to really cry out for relief here. None of them can borrow or print money the way the federal government can. Most of them have constitutional or legal balanced budget requirements. So it's the federal government that really has the flexibility here to put money into these local municipalities, counties, and states and help them through this problem. Otherwise, it's a problem that is very easy for the federal government to solve, very hard for local governments to solve because they simply don't have that flexibility of just printing more currency. So it's kind of a mean-spirited thing to say, particularly when you're running the kind of deficits the federal government is running, that, oh, the states aren't taking care of their budgets and they're not being responsible. Come on, guys, they got hit by a coronavirus, and you're the ones who have the access to the resources that they don't. I think the logic becomes inevitable.
Congressman Cicilline, the HEROES Act that the House passed last week did have quite a bit of money for state governments as well as local governments. Now, we've expressed here, it's very unclear the fate that has in the Senate, but what amount of money from the HEROES Act would be able to be applied toward this $235 million current fiscal year deficit that the state government is facing here in Rhode Island?
Well, the HEROES Act provides approximately $5.5 billion to the state of Rhode Island over 2 years. all of which would be available to be used for lost revenue by state governments, local governments, and county governments. But since we don't have county governments, that money allocated to counties would go to the cities or towns in those counties. So it's a substantial assistance to local governments, a very substantial assistance to state government. And to answer your question directly about state leaders and whether they should be planning for this, I want to join Congressman Landry. I think the governor has done an extraordinary job in leading our state during this pandemic, a remarkable job in every way. And I think she's trying to make judgments about what she can expect from the federal government and trying to protect the state services, just like the mayors and town administrators are. How do we protect jobs and protect services to our residents in the anticipation of some federal assistance? But Sheldon's exactly right and Senator Reed is right. They're going to, Senator McConnell is going to hear from his colleagues in the Senate representing states all across this country, from their mayors, their county supervisors, their town managers, about the urgency of this financial challenge, about being faced with having to lay off police officers or firefighters or teachers and healthcare professionals. And I think the pressure is going to mount, and the Senate is going to be required to take action to provide relief to state and local governments. And we just have to keep the pressure on, because it matters not only to Rhode Island, but it matters to states all across this country.
Well, just give a final word to Congressman Landry. I mean, it sounds like all of you are bullish on getting something through Congress at some point, but with 6-ish weeks left in the fiscal year and such a big hole to fill, there's no guarantee for Rhode Island leaders at the state level here.
Correct.
Correct. Although I would point out that we did the 4 bills 2 weeks apart, March 6th, March 18th, March 27th, and April 23rd. So those were in 2-week increments. So if the Senate wants to move, if Mitch McConnell wants to bring a bill to the floor, he can do it easily within the time that's left.
Yeah, I strongly hope and encourage and want to pressure Mitch McConnell in every way possible to get that bill through the Senate. And they don't like things that are in the House bill, fine, but he can make the adjustments, hopefully in a bipartisan way, and get it back to the House for us to pass through the House and then get it to the president as soon as possible. Failure is not an option here when so many people are under pressure, families are under pressure, lives are on the line. This needs to get done, and we need to make sure that the resources are there so that we keep our state whole and get through the other side and come out stronger.
We're 3/4 of the way through this town hall right now, so I want to move on to another viewer question that went into 12 responds, and this one as well we have gotten a lot. It is about hazard pay for frontline workers. Some of you have touched a little bit on this, and Elizabeth writes in, what is the status of Senator Reed's Heroes Pay and Senator Mitt Romney's Patriot Pay that would provide additional pay for essential workers? Those of us who have continued to work through this crisis seem to be forgotten. Now, Senator Reed, since Elizabeth mentioned you in her question, I will direct it to you. But based on the comments made by the Senate Majority Leader, it seems unlikely for Elizabeth that this pay is around the corner.
Well, I hope it's not only around the corner, I hope it's realized very quickly, because we owe a debt to these individuals. They're risking their health. They're doing jobs that are absolutely critical to the country, to the state, and we just can't simply, nod to them and say thank you. We've got to provide them some real support, some real resources. That's why I introduced the legislation. Senator Romney has introduced similar legislation. It's included, as I believe, in the HEROES Act, so the House recognizes this. And this is not only a tangible recognition of what they've done, it also, in my legislation, would provide resources for recruiting, because we're going to need additional nurses and healthcare professionals and people working in facilities like nursing homes. So we need to be able to recruit them. But this
briefly, Senator, would you consider Senator Romney's proposal, which is a little bit shorter than yours, in an effort to get it passed in a bipartisan way?
I've been reaching out to Mitt on several different issues across the board. He's quite a distinguished gentleman. I think you have to work with your colleagues, and if we could come up with something that was mutually satisfactory and get it through, that would be a good day's work in the United States Senate.
You know, Congressman Cicilline, since the House passed the bill, I think a lot of people watching this at home are going to want to know, all right, who does it cover? If I'm obviously if I'm working in a hospital, it sounds like it does cover. But what about a grocery store worker? What about somebody who works in the post office? Who would be paid the extra hazard pay under the current bill?
So under the current bill, it's a $200 billion HEROES fund for people who have regular contact or are regularly exposed to the danger of contracting the coronavirus. So it would be grocery store clerks, first responders, police officers, healthcare workers. The employer makes application for the hazard pay. It's up to $10,000 of additional pay, $13 an hour. And there was broad consensus in the House Democratic Caucus that as we looked at this pandemic and you look at the incredible heroes on the front lines, working in our hospitals, working in the grocery store, responding to rescue calls, our police and fire, who are risking their lives, are going home, risking the lives of their families to keep us safe, to protect us, to get us healthy. And they deserve not only our deep gratitude, but they deserve additional compensation for enduring that hazard. And that was one of the biggest priorities of the HEROES Act. I'm proud it's in there. We worked hard to include it. And I hope the Senate will pass some very strong version of hazard pay, because the heroes on the front line that are doing this incredible work. And when you think about the story of this pandemic, the thing I think people will remember are those nurses and doctors and first responders that are risking their lives every single day in really dangerous circumstances to keep us safe and healthy. They deserve compensation for that.
These really are the frontline workers that are going to work every day, putting their lives on the line for all of us. There was such broad consensus in our Democratic caucus to look out for them and the way that they are looking out for us, and having a hazard pay in there as a key component of the legislation. The HEROES Act that we just put through was absolutely one of the top priorities that we had to see in there before it would leave the House. And I'm glad that it was.
Senator Whitehouse, along the lines of, it's not exactly hazard pay, but you did put in a bill in the last week and a half or so for nursing homes, which of course have been the epicenter of the crisis here in Rhode Island. Can you just briefly explain, what kind of funding that would be if that were to pass into law or become part of one of these stimulus bills?
Well, we've asked for $20 billion. It would authorize best practices to be brought into these nursing homes. It would authorize supplemental pay for people who are working in harm's way. It would authorize surge teams who can come in the terrible eventuality that a nursing home can't staff itself any longer because there's been too much exposure and too much quarantining. So somebody has to come in and respond and take over and be the surge team. I hope very much it can be part of a package, and we will see. But clearly, nursing homes have been at the epicenter of this crisis in Rhode Island, and nursing homes have been overlooked for a long time. This has been a real wake-up call to improve our support for nursing homes and for the residents who live in them.
Well, our hour is growing short, so we want to touch on a couple issues specific to each of you on things you've been working on in Congress. And actually, Congressman Langevin, I'm going to start with you. Last week, the House approved new rules to allow for proxy voting and remote voting by lawmakers. And for those with a long memory, you had a bill early in your time in Congress after 9/11 that would have created procedures for remote voting in an emergency. It didn't pass at the time, but there have been people who pointed and said that you were kind of ahead of the curve on this. But you still hear Republicans saying last week that those changes damage Congress as an institution, that you have to be there in person. What do you say to those concerns that you're just fundamentally changing Congress if you folks aren't all in place together to vote?
Yeah, I heard those arguments years ago after 9/11 when I was part of a continuity of Congress task force to look at what we needed to do to make sure that Congress could still continue to function in time of an emergency. You could envision a time where we couldn't get to the Capitol, or if the Capitol, God forbid, were ever destroyed, or I said that if there were ever a biological event, perhaps that would prevent us from actually being around each other in closed areas, that we would have to find a way to operate remotely. And unfortunately, there was not buy-in then. This is the 21st century. Clearly, we should and can have the ability to debate and vote remotely. I'm glad that the Congress and that the House of Representatives has made the rule changes necessary to start facilitating that happening only in emergencies. I believe that we should be having face-to-face communication and be on the floor debating and voting in person whenever possible. But we have to be realistic about the fact that there are contingencies, there are circumstances that are going to come up, like what we're facing right now with coronavirus. The work of the Congress, the work of the American people cannot come to a screeching halt. We have to be able to legislate, pass emergency measures, to put through legislation, continue to do our oversight work in our committees, and make sure that we're able to not only debate but vote remotely if necessary. These
Senator
are extraordinary
Reid,
circumstances, and they need to have appropriate measures to allow us to function in this type of a way.
Senator Reid, I have a question for you as a member of the Banking Committee. You heard Senator Whitehouse earlier in one of his answers talk about printing money, and the federal government certainly has been doing that. There was the first package was $3 trillion, or all of them all told, and now there's a talk of raising that to $6 trillion. Are you concerned by the amount of debt that this country is racking up through all this stimulus funding? There are a lot of people watching this right now who remember full well the inflation from the 1970s and are worried that we're going to return to that. What do you say to them?
Well, I think the best expert on that is Governor Powell, the chairman of the Federal Reserve, Jay Powell, and he is quite adamant that now is not the time to take the foot off the pedal, that if we begin to pull back, then this dilemma, economic distress we're seeing, will not be solved. It'll be prolonged. I think the key now is to put more resources in place, in the right places. Get support for families who are unemployed. Get support for families who are facing the loss of their home or being evicted. Get those supports in place, and that'll help us recover.
But the flip side of that argument, Senator, is to allow the economy to try and repair it and not have the government come into the rescue all the time, because it could do the economy long-term damage. It sounds like you're not.
Well, I think there's two factors that the economists are looking at, and we should look at too. First of all, the Federal Reserve is keeping interest rates virtually at zero. So the idea of borrowing money, which essentially we're doing, we're borrowing and interest rates are very, very low. So this is not a situation where the interest rates are awfully high and the cost of the borrowing is extraordinarily high also. So second, I think that we've seen inflation in check for the last decade or so, even though we've seen deficits grow. I mean, one of the first things that the president did was pass a significant tax bill that cut taxes mostly for the very wealthy Americans and incurred a significant deficit over 10 years. I think there's trillions and trillions of dollars. And by the way, the Republicans were not bemoaning the fact that the deficit was rising in that case. And one of the phenomena, though, is that even with that deficit spending, you didn't see a spike in inflation. If you started seeing inflation spike up, then the Fed would have to change their approach. They couldn't be as aggressive as they are with their lending facilities, et cetera. I don't think we can totally ignore and assume away that inflation and deficits will never be a problem. But at this juncture, unless we provide robust stimulus, both through monetary policy at the Federal Reserve and through fiscal policy in the United States Congress and the United States government, we're going to be stuck in this economic malaise with unemployment now at 15%, with businesses that are not going to be able to reopen, with consumers who are, they want to go back, but they're afraid because this virus hasn't defeated yet.
Okay.
I think the path forward is to move out aggressively. And then when the economy is recovered, when we're getting, GDP increases, when tax revenues are going up because more people are working, and we can make other adjustments then.
All right, we have, believe it or not, just a couple of minutes left in this town hall. And since these are unprecedented times, Ted and I wanted to give each of you an opportunity, 30 seconds for your final thoughts here. And Congressman Langevin, we'll start with you.
Well, first of all, I want to thank you, Ted, Tim, and WPRI for allowing us to speak directly to Rhode Islanders and communicate the important work that we're doing on their behalf in Washington. This pandemic is something that is just unprecedented. It's affected too many individuals and families whose lives are now disrupted through no fault of their own, but because of this coronavirus. We are in Washington fighting for you. We are united as a delegation, we know what the priorities are. We know that we are looking out for your best interests and your needs right now. We are going to get through this time. We're going to get through it together. There is no time to waste. We feel the urgency of now, and we are doing everything we can to make a difference so that we get through this, and you're stronger and made whole.
Thank you, Congressman Langevin. And Congressman Cicilline, 30 seconds, your final thoughts here.
Thank you again for hosting this town hall. I want to just reassure Rhode Islanders, this is a really hard time. I know people are anxious. There's a lot of anxiety about your economic condition, about the health care, but just know that we are working very closely with the governor, with the mayors and town administrators, the state government to do everything we can to mitigate the consequences of this pandemic. Please look in on each other, check in on your friends and family members that maybe you don't see regularly, make sure they're okay. This is a hard time for everybody, but our state motto is hope. We're going to get through this. We're going to all get through it together, but no, we're fighting every day for you, and thank you for doing this.
Senator Whitehouse, 30 seconds.
Just thank you. Rhode Island and America have had a very abrupt education in who is really essential. And to the nurses and to the doctors, to the cleaners and the sanitizers, to the truck drivers and postal workers and grocery clerks, to the people in the CVS counter and the people keeping the lights on at National Grid, a lot of people have not gotten a lot of credit and have really come through in the course of this. So to all of them, thank you. And to all of us, be kind, reach out, be strong, better days are ahead.
And Senator Reid, very short on time, 30 seconds.
Well, I want to thank you, but I also want to thank the people of Rhode Island. I want to end where I began. The people of Rhode Island in this crisis, a remarkable crisis, have shown common sense and common decency. They've made us all proud, and they've made us work harder and harder for them, and we'll continue that work in Washington. I particularly want to thank those essential workers, the nurses, the doctors, the EMTs, the firefighters, the police, the janitors who clean the nursing facilities, all those who've done so much, who actually put their health at risk. You've made us all proud to be Rhode Islanders, and extremely proud that we're able to represent you in Washington. And also you've inspired us to do much, much more, to do our best, and to work harder to get through this, and we will get through this.
And we want to thank all 4 members of our federal delegation for joining us for this Congressional Town Hall. And make sure that you stick with us for round-the-clock updates on coronavirus concerns. You can head over to WPRI.com. We'll also have new information and a breakdown from tonight's 12 Town Hall on Eyewitness News at 10 on Fox Providence and at 11 on WPRI 12.
And we truly appreciate all the questions you've been sending us throughout this crisis. Be sure to check out the 12 Response section on WPRI.com. We posted answers to many of your concerns there.
And thank you again for watching this special presentation. To everyone out there, hang in there and please stay safe. For Ted Nesi, I'm Tim White. Have a great night.